5 provinces. That's the number from the DRC health authorities today, and it changes the map we've been drawing all week. If you're just joining us, DRC's Bundibujo outbreak was declared in Ituri province back on May 15th, and it kept expanding. Prior reporting had it at 1,759 confirmed cases and 600 confirmed deaths. Labs are calling this the country's 17th Ebola outbreak and the 3rd documented Bundibujo virus outbreak, a subtype with no licensed strain-specific treatment on the shelf.
This is Ebola Watch. Today, the caseload's climbing toward 1,900. The provinces are multiplying, and we've got a piece arguing African scientists are the ones running this response. Let's map what 5 provinces actually means. If DRC Bundibujo Ebola outbreak matters to you, hit follow. We'll be back on it soon.
Xinhua writes,
Kinshasa, July 12. Xinhua. The Democratic Republic of the Congo, DRC, has reported Ebola cases in 5 provinces, with the nationwide tally rising to 1,873 confirmed cases, including 672 deaths, according to a report released Sunday by the country's health authorities.
Update on the DRC Bundibujo outbreak. The national tally is now 1,873 confirmed cases across 5 provinces, with 672 confirmed deaths. Both numbers come from the country's health authorities via Xinhua, with data through Friday. And I want to be precise about the 5. Ituri, North Kivu, South Kivu, and now Haut-Uele and Chopo, both in a national situation report for the first time. Investigators link those 2 back to the Ituri epicenter through contacts and population movement.
Okay, so that's the map moving, not just the number. Chopo, that's Kisangani. The case that looked like an outlier a few days ago is now part of the pattern. And 672 deaths out of 1,873 confirmed. That's a case fatality ratio around 36%, and you can do that math yourself. Kara, is that in the range we'd expect for Bundibujo?
It's within the historical band for that strain, yes, but be careful with the denominator. There are also 299 suspected cases, with 91 more deaths sitting outside that confirmed count. The 36% is off the confirmed line only.
Right. And the bed number, 763 in isolation or treatment, occupancy at 95.1%. With 5 provinces now, there's basically no slack left.
That's the sentence I'd underline. 95% occupancy means any further surge has almost nowhere to go, and Haut-Uele and Chopo showing up now tells us the surge isn't hypothetical. The African Mirror writes,
As dusk settles over Bunia, the bustling capital of Ituri province in northeastern Democratic Republic of Congo, near the borders of Uganda and South Sudan, workers in protective boots move between newly erected structures beside one of the city's largest treatment facilities. Under floodlights and with the sound of hammering, teams continue building additional wards and support areas, expanding the capacity of a hospital that can accommodate around 80 Ebola patients.
So we just walked through the Xinhua numbers. 5 provinces, caseload near 1,900. This African Mirror piece is the other half of that. Who's actually running the response? And it's built around Bunia, the treatment facility we've been following all week.
Right, and what's new here is how it frames the response. It puts African institutions and scientists at the center, with governments coordinating across the Ituri borders with Uganda and South Sudan. Not just the virus's moves, but who's accountable for stopping it.
Okay, but the piece opens on floodlights and hammering. They're still building wards. That hospital tops out around 80 Ebola patients. With cases near 1,900 across 5 provinces, can you actually see the confidence this article projects on the ground, or is this press release confidence?
Both can be true, Daniel. An African-led response doesn't erase the logistics gaps I've been flagging. A dose in Geneva still isn't a dose in Butembo. But cross-border coordination between Kinshasa and Kampala isn't background noise here. It's a disease control variable. Putting that border work on the record is a real shift in the story, not spin.
80 beds in a construction crew, though. The confidence and the capacity aren't in the same place yet.
If you follow Ebola Watch for clear outbreak updates, try Hantavirus Watch. Daily updates on the 2026 outbreak, including the MV Hondius Andes virus cluster, CDC and WHO response, contact tracing, and traveler risk. Find it wherever you get podcasts. We've put links to every story from today's briefing in the show notes, so if one caught your attention, you can go straight to the source and read more. That's Ebola Watch for today. This is a Lantern podcast.